as you've talked about, cannabis is legal in many states for medicinal use. Typically, that means that you have to go to a doctor and get a diagnosis that fits within a certain category of diagnoses. Every state is a little bit different about the different conditions that they will allow you to get a medical marijuana card for. Um, and there is a pretty wide variety of conditions in Massachusetts that they allow to fall kind of under that umbrella. So some examples are cancer diagnoses, glaucoma, HIV/AIDS, hepatitis, ALS, Crohn's disease, Parkinson's disease, and MS. But Massachusetts also says that you can get a medical marijuana card for any other debilitating condition as determined by your doctor. Talking about the actual research on what marijuana has been shown to be useful for in terms of treating medical illnesses, that is a little bit more narrow. There hasn't been a ton of research done on the effects of marijuana because it's still a federally controlled substance. So there isn't a ton of evidence
Okay.
for its usefulness with a lot of these conditions. And for the most part, there doesn't seem to be a ton more efficacy than a placebo for most of these conditions.
All right.
So it is very important to note, just like you said, that the effects of marijuana, and really the chemical that we're talking about right now is THC, vary very, very widely depending on the individual person. And so there are a lot of factors that can contribute to how marijuana affects you individually. For instance, your genetic makeup, your age, your assigned sex at birth, the amount and the strength of the marijuana that you're using, how you're using it. So are you smoking, vaping, or using an edible? How long you've been using marijuana, how frequently you use it, and whether
Wow.
or not you're using other substances or taking other medication. Even though lots of people think otherwise, I think there's a very popular opinion that you cannot get addicted to marijuana. That is not the case. So just like any other substance use, there is a cannabis use disorder diagnosis that we do give people who are experiencing cannabis addiction. And what that looks like in terms of how we diagnose it is really whether or not a person's use of cannabis is causing negative effects in their life. And that could be to their physical health, to their mental health, their
Okay.
social life, their
So,
family life,
yep.
their legal
Okay.
situation, really anything that is a significant impairment
All
either
right.
in their functioning or their happiness.
Uh,
The effects of marijuana on youth are similar to the effects on adults in that there can be kind of what people are talking about in terms of desired effects, in terms of getting high or feeling positive effects. But then there also can be negative effects, just like on adults. And so some of the things that people kind of look at as like a little bit more negative, are things like dizziness, issues with coordination. You can get panic or anxiety, dry mouth, nausea, increased heart rate. There are all sorts of kind of physical symptoms. But the thing that we know, I think that's the most important to look at with youth is that the younger you are when you start regularly using marijuana, the more likely you are to develop a substance use disorder in relation to marijuana as you age. And the numbers they vary a little bit depending on the source. But you're somewhere between about 3 and 5 times more likely to develop a full substance use disorder if you start using in your adolescence as opposed to
wow.
starting to use